right, Sloaney, back on 700 WLW. Something you may not know about, and I want to point this out because I think it's very important. As you get near or certainly past the age of 50, you know all about our friend osteoarthritis. And if you have some joint pain or something like that now and you're younger, you're going, what is that? It's called arthritis. And managing that chronic pain can kind of be frustrating. And not only that, it should scare the hell out of you. We hear horror stories all the time about opioids. It leads to fentanyl. It leads to a whole bunch of other things. And so you're reluctant to even treat the pain. But there's a newer solution out there to joint pain, and it's low-dose radiation therapy. They're saying it's a game changer. And joining the show this morning from OHC, and that'd be OHC West, radiation oncologist Dr. Matthew Bertke. Good morning. How are you, Doc?
I'm doing well. How about yourself?
I'm doing good. I wish I would have known this a while ago. I have to have, so I've got like late stage 4 arthritis in my right shoulder. So it's bone on bone, no synovium, no synovial fluid. So I have to total joint arthroplasty, which is not going to be fun in October, but at least the pain will go away. Because right now I'm popping Advil like they're Pez. You know what I'm talking about?
That's for sure. Unfortunately, you're not alone there. It's a pretty common thing.
Mm-hmm. I had fun wearing it out. At least I did that. So let's talk about this. If you have that kind of pain and you're like, wow, my knee hurts, generally it's knee, wrist, hand, arm, back, shoulder, certainly. It happens and presents all over the body. So I'm hearing about low-dose radiation. Of course, I'm thinking about the Manhattan Project. And I'm going, well, I know radiation's bad for me, isn't it? Even low doses, doesn't it add up in your body? Is there a concern that this could wind up causing more problems down the line, like speaking of which, of cancers and the like, because you're being exposed to radiation? How does that work?
Yeah, that's a great question to ask. And, was one of the things that kept us from kind of doing this on a more widespread scale until more recently, mostly because of that public perception of the risk. Now, I think the key is the low dose when we talk about low dose radiation therapy. We're talking about much, much lower doses than we use to treat, say, cancer, for instance. And at these very low doses, there have been no proven side effects in terms of, secondary cancers or other risks to the tissues in that area, just because of the very low nature of the radiation. So whereas it's something that we certainly worry about when we're given higher doses for something like cancer,
right.
This is kind of a very different topic.
How much different, let's say, comparatively speaking, for the layperson, doctor, would the difference between, let's say, a typical X-ray or imaging versus this treatment?
So this is more on the order of a typical X-ray or CAT scan, except we're targeting a smaller part of the body. So when we think about radiation, we have to think about not only how much dose we give, but where we're giving it. And giving a small dose of radiation to a knee is a lot less risky than giving a whole body CAT scan with contrast.
Right.
So, this is a treatment that has kind of low risk on the level of the standard imaging that you think about going into the hospital for.
So, yeah, it's probably like a, I don't know, I'm saying the device, but stereotactic. So it's directed towards that particular joint, not the whole body.
Correct. Yeah. So this is targeted. We focus on the joint and the whole joint space. So not just that bone on bone, like you were talking about before, but kind of all the fluid that surrounds the joint, because it works as an anti-inflammatory. So, kind of like you think of your Advils, your Aleve, things like that,
right,
that are meant to be anti-inflammatory. Well, this does it kind of on a different kind of cellular level and targeting all those inflammatory tissues and cells within that joint space to kind of turn that inflammation down. That's how this works.
Interesting. So the cells, the leukocytes, all that technical macrophages and all that technical stuff that's activated. Basically, it does it temporarily block that pathway? What's going on inside my body with that?
So it works on a level that is going to give you most likely more longer lasting pain relief than, something like a topical gel or a pill that you take. Those anti-inflammatories are only working for on the order of a few hours.
Right.
Most of our patients that receive this treatment get pain relief anywhere on the order of 6 months to 2 years or longer. Wow. In terms of how durable the treatment is.
Interesting. Dr. Matthew Bertke is on. He's a radiation oncologist at OHC, and new therapy out for those who suffer from osteoarthritis, which is like, well, pretty much anyone over the age of 45. I think everyone's we're beating the hell out of ourselves. Well, we're exercising more. People are more active, younger people especially. But I watch people do CrossFit and stuff like that, and I try to remain very active myself. And it's funny because somebody will tell you is like, it's just pain is just temporary. Like not when you're past 50, it's pretty permanent. I'm going to let you know. All the stuff you're doing now, you think it's good for your body, you're going to wear out some joints, and that's true. We're living longer too, so this arthritis and osteoarthritis especially is absolutely booming, and that's not a good thing. But low dose radiation therapy, LDRT is what it's called. They do that at OHC, and I guess anyone over that age. Do you have to be presenting with symptoms? If you say, "Hey, my shoulder hurts a little bit," what's the range of I guess the typical patient that's indicated for?
Yeah, for sure. So, now every patient's different, obviously, but typically patients that we consider for this treatment are, over the age of 45, and they have, persistent arthritis pain in, either a single or multiple joints. And typically they've already tried some more conservative measures, like the rest or rehab. They've tried the topical pain relievers, like the gels or the anti-inflammatory pills. And then kind of along the same pathway where maybe you'd be considering joint injections or things like that, that's when you can start considering low-dose radiation for arthritis relief before you get to the stage of requiring surgery.
Okay.
So it kind of fits in that same realm of, when you would be thinking about doing joint injections and you're kind of tired of popping those Advil.
Gotcha. So for someone like me where there's no differentiation between the ball and the socket, and I don't find my humor is very funny, by the way, you can't fix that.
Well, so I wouldn't say that because I do have some patients that for whatever reason aren't able to get a surgery and they already do have, dramatic wear and tear on their joint to where they're bone on bone and they do get relief. But sometimes that relief is not as long lasting because you can cause more inflammation quickly when there's bone on bone.
Yeah, it makes sense. All right. So how long does the procedure take? How many treatments do I need? What is that course?
So depending on the situation, we typically do between 5 and 8 treatments of radiation. Each one is quite quick. It only lasts maybe 5 to 10 minutes each session. There's nothing that you see or feel during radiation. It's kind of like getting a chest x-ray or a CAT scan. You're kind of laying there on a table and the machine's moving around you doing its thing, but the radiation itself is invisible and it's being targeted precisely at that joint while you're just laying there relaxed.
Okay, yeah, that makes sense. So do you start to notice results right away, and how does that work?
Most of the patients that I've treated start seeing results about halfway through their course of radiation, so maybe 2 or 3 treatments in. But a lot of times we see the biggest relief in the weeks after we're done, that kind of delayed inflammatory blockage.
Boy, it seems like this is the tip of the iceberg. I mean, how long ago was this discovered? And I'd imagine you're probably treating patients for tumors and things, and all of a sudden, hey, by the way, this doesn't hurt anymore. And often a medicine or a treatment is indicated for something else, and you wind up going a whole different direction, right? I mean, it seems like every drug we have is like, well, it was for this, but it turns out it's going to fix something else.
For sure, and that kind of is how it first got developed, but this has actually been around for decades, and it's in much more popular use in other parts of the world. In Europe and Germany, for instance, a large chunk of the radiation treatments they do are for benign conditions like arthritis or plantar fasciitis rather than for cancer. It's just not been as popular in America, mostly because of those, radiation safety concerns like we talked about earlier in our conversation.
Yeah.
And as we've kind of proven some of those, to be, not as big of a risk as originally was thought, a lot of us are trying to roll it out to the public to try to help more people here in America.
How typically, what's your success rate? I mean, obviously every drug, every procedure and intervention isn't always successful. We know that. You're not going to bat 1,000. You're not going to bat. But in this case, what typically can I expect?
So most of the data that you look at will show about a 3 out of 4 success rate in terms of noticeable pain relief, where patients either require less medication or no medication, or are dramatically improved in terms of their pain. Our results have been similar to that, maybe a little bit higher, maybe more like 4 out of 5.
Oh, wow.
But the response rates have been really really reassuring to see, and it's been something where even some of my patients that were self-admitted doubters of the treatment, but were kind of at their end of their rope and were decided that they were going to give anything a shot, have been pleasantly surprised at the response they've gotten.
And it seems to me that this sounds like it's more successful than, for example, if you had a knee joint, a lot of people are doing the knee gel inject, the visco supplementation, I think is what it's called, knee gel, that this is more successful than that.
I would say that they're pretty similar.
Okay.
It's hard to compare the two because I don't have a clinical trial to point to that directly compares them, but I think our experience in terms of the benefit that we get is probably similar to the knee injections. In my personal experience, I think the duration or how long the treatment lasts tends to be a little bit more of a durable or longer lasting treatment with the radiation compared to some of the knee injections. Especially once you've done injections a few times, they sometimes kind of just wear off in terms of their effectiveness.
Right.
If you do them over and over.
Yeah, like, steroids, you get 3 bites of the apple and that's it. So this is the more extreme version of that. And I think but this has got to show promise in a bunch of other areas as well when it comes to long-lasting pain relief, right?
Definitely. So arthritis is, a big one. And obviously, like you mentioned, it affects the majority of people if they're a little bit older.
Uh-huh.
But other things too, plantar fasciitis and other more inflammatory related things can also be treated with the same technique.
Yeah, very, very interesting. If only I could target that at people that cause me pain and problems, that would be awesome too.
I'll work on that.
Yeah, get on that. I don't know what you're doing this weekend, but let's try to be more efficient here. Dr. Matthew Bertke is a radiation oncologist. He's at OHC, I believe, in the West Side. And we're talking about low-dose RT, LDRT, low-dose radiation therapy, which has been used in Europe for a while. It's been cleared here in the United States. People are a little leery about it, probably because they're talking about radiation, but we're seeing long-lasting results for osteoarthritis. So you've got knee or joint or back pain or elbow pain, whatever it is. And once you start to get in your 40s, you start to learn about our good friend arthritis. And then when you're broke down and old like me, then you have to start getting joints replaced. This won't stop that though, right? This, if you're doing something wrong or you're just inclined to osteoarthritis, my family is, and that's why I am where I am, this isn't going to reverse anything, right? This is just a pain relief.
That's correct. Yeah, it's not going to build back the cartilage or build back any of the structure. And unfortunately, wear and tear is a fact of life on the human body. But we're basically trying to slow down the inflammation and slow down that rate of decline, and maybe put off the need for a surgery to longer in the future, or prevent it altogether if possible.
Well, not only that, people have cringy a little bit about radiation, and I get that. But in low doses, it's we're not seeing long-term effects and the buildup in your body. But the other element, and there's a clear and present danger, as we know, about opioid addiction. And this, to me, is a much better alternative than getting on some sort of prescriptive medicine that could lead and ultimately cause my death or imprisonment. God only knows what will happen. And there's a lot of horror stories about that. I don't want to get, most people hear OxyContin, they're like, I don't want anything to do with it. This seems like a reasonable, non-addictive, habit-forming alternative that you don't have to take every day.
For sure. And, I'd certainly encourage people to try things like the anti-inflammatory medications if that's something that their doctor recommends.
Yeah.
But the opiate medications are kind of a whole other class that, have kind of rightly gotten a little bit more of a concerning connotation in the public, and something that, I think we should be rightly cautious of. And obviously radiation is not something that has addictive potential or some of the other bad effects that you can see with opiates.
Yeah. Is this covered by insurance? That's probably the other big question people would ask.
It is. So it's covered by Medicare. It's covered by private insurance. It's in their guidelines in terms of it being a safe and approved, effective treatment. So we have not had any issues in terms of, insurance approvals or problems like that.
All right. Dr. Matthew Bertke at OHC West specifically is where your practice is located. He's a radiation oncologist and the benefit of low-dose radiation therapy for joint pain. That's incredible. Hey, thanks for joining. Really interesting stuff, and I appreciate you coming on this morning.
Yeah, thanks for having you.
Take care. Let me get to a news update, and we've got Reds around on the Cowboy. Reds get buttered by the Cubs last night. Not good. As the playoff dreams continue to just simply fade away. But we'll see. There's a little bit of time left. We'll see. So, yeah, we got that. Then it's news, and then your Willie's here, 12:06 today. I just saw him, so I know he's ready to go here on the home of the Reds, 700 WLW Cincinnati.